So, Dr. Thomas here with Julie. Julie had a sleeve gastrectomy 43 weeks ago. So, Julie, I want you to kind of explain to the audience here what it was like in the first days, the process to the beginning, what it was like getting into the office, what it was like the day of surgery, what it was like the week after surgery, and then we'll talk about the other stuff later.
Okay. Coming into the office initially, I came in prepared to have the lap band, and then we discussed having the sleeve. I was freaked out a little bit, so I had to go home and research it for myself because I wasn't prepared for something permanent at first. After I researched it, then I decided for sure that was the right thing for me.
Let me ask you about that. So you researched it. What resource did you find was best for making you understand what the sleeve was all about?
Several websites. I'm trying to remember all the ones that I went to. I read everything I could on the internet about it.
How about the Emmy program that we have on our website?
I did go to that. Yes, your website's always fantastic.
Okay, good.
And then reading people's comments online, I read a bunch of people that had revisions and what they were writing about from the lap band to the sleeve. And just people that only had the sleeve, how successful they were and how happy they were with it.
So now that you're 43 weeks out, do you remember bad advice that you got?
Yes. I mean, I remember people telling me not to do it. I was crazy to do it. That I wasn't heavy enough to do it, or that I could do diets and exercise, which I had tried forever, and it never worked. Or it would work for a while. I would always lose weight, but then I would gain weight back. So I never could consistently keep the weight off.
So let's talk about that. You're 43 weeks out. You've lost 63 pounds, which is 77% of excess weight loss, which is excellent because anybody's way too skinny at 100%. And clearly, everybody can see that Julie looks fantastic.
Thank you.
So a lot of that bad advice saying we're not big enough, all that. But let's kind of jump to the big key question. What's better now that you've lost 63 pounds?
Well, my entire life, obviously, but
specifically,
I feel more confident. I feel healthier. I quit smoking the day of surgery and had no intention of.
Fantastic.
I thought that I would go back to smoking, but I had to quit for the surgery. But I just decided to give it a try, not to smoke, and I haven't smoked since, which has made me feel better. I physically am so much more active. Before, I tried to walk 2 miles. I started out walking 2 miles. And now I can run the entire 2 miles.
Now you can run 2 miles.
Run the
you
entire
already told me
2
that
miles.
was a huge
yes,
deal for
and
you.
that's great. And now I'm going to bump it up,
Good for you. And there was no way you could do that before, is that right?
Oh, like I literally was out of breath, and my husband would go with me, and I would like want to stop after a mile every day, and he would just push me to keep on going. And
so
now,
you feel healthy and feel like you're getting healthier.
Continually, yes.
Yeah.
I'm still losing. It's just a little bit slower now. But yeah, I feel very healthy. I feel healthier now than I ever have in my life.
Fantastic. I want to ask one other thing. Can you walk them through what it was like the day of surgery, the day after surgery, that week after surgery, how quick you were back to doing things?
Yes, the day of surgery, I don't remember much. Obviously, it was okay. The next day, I woke up, and I had some pain. It was controlled with pain medication. And then I ended up having to stay 2 nights in the hospital. So by the next day, I felt like a new person. I was ready to go home.
So typically when we have to keep people's second night, it's because of nausea. So I assume you were one of those that had nausea.
I did have nausea. And
was it completely gone by the next morning?
If I remember correctly, I think I came home with something, but it was nothing bad. By the time I was ready to come home the third day, I was a new person. The second day was hard for me, but once you came in and changed my meds up a little bit, I was nauseated, and I think even having something come up. But you changed my medication, and that started fixing it right away.
Good. How many days before you were getting out of the house and doing things and driving and those kind of things?
Like the day we came home, which was the third day, I felt fine then, really, as long as I took my pain medicine. I took my pain medicine maybe for 3 or 4 days. I was going normal when we came home.
So the week after surgery, how did you feel?
I already started feeling great.
Yeah.
I mean, instantly I started feeling fantastic.
Great.
I really did.
Thanks for sharing.
Thank you.